Hey everyone, and welcome back to Breaking Down Nursing. Have you ever heard a nursing mnemonic and thought, there's absolutely no way that's real? Well, welcome to nursing mnemonics that sound silly, but actually work. I'm talking about one of the most famous cardiac mnemonics in healthcare. Let's chat about MONA, or as some like to call it, FONA. And honestly, it sounds silly, but it works great. So picture this. You're a nursing student, you open your cardiac chapter, and your instructor says, remember MONA for chest pain. And you're like, who is MONA and why is she treating heart attacks? So let's talk about what MONA and FONA is. MONA stands for morphine, oxygen, nitro, and aspirin. Some physicians prefer fentanyl instead of morphine, so that's why we also have FONA, which is the same except the opioid choice is different. So it's fentanyl, oxygen, nitroglycerin, and aspirin. So what are these drugs and what do we use them for? And why are they so important to chest pain patients, especially when we think somebody's having a heart attack? Let's start with morphine. Morphine is a potent opioid analgesic. So why do we use it for chest pain patients? It relieves pain, it decreases anxiety, and it can reduce cardiac workload. The things you have to watch for, the contraindications, are low blood pressure. So systolic blood pressure less than 90, because remember, narcotics can drop blood pressure. And also somebody's respiratory compromised. Opioid analgesics can cause respiratory depression. And so we want to make sure there's not an airway or breathing issue before we start the medication. And as always, monitoring for any allergy. Next is oxygen. Everybody needs oxygen. But the thing to remember is we give oxygen to keep stats above 94 because in chest pain patients, especially if we are considering them for a heart attack, they need to have higher oxygenation status. So instead of the 92, which is normal every day, we'd want to keep them above 94%, especially for NCLEX purposes. We want to make sure they're fully saturated. On the other side, we also don't want to give patients oxygen that don't need it. So if they come in and they're above 94 to begin with and not in severe respiratory distress or another reason we would give them oxygen, we don't want to give it. Routine oxygen may not be needed, and too much oxygen can create issues like nitrogen washout. And in the long term, high FiO2 or oxygen can lead to pulmonary fibrosis or scarring in the lungs. Next up is nitroglycerin. Nitroglycerin is a potent vasodilator. And this is a medication that nursing students either love or fear. So what does it do? Nitro dilates the blood vessels, which then reduces cardiac workload, which improves blood flow. But always remember, before you give it, you need to check blood pressure, because one of the contraindications for nitroglycerin is a systolic blood pressure less than 90. Because as it vasodilates, blood pressure will decrease even more. Because nothing says bad day like turning a blood pressure from 90/50 into 60/30. Of course, always monitor for allergies to the medication. And of course, if they've taken a phosphodiesterase inhibitor within 24 to 48 hours, like Viagra, Cialis, we don't want to give it either. That would also be a contraindication to administering nitroglycerin. So make sure to ask your patients. And that means all of them, because at the end of the day, phosphodiesterase inhibitors are also used for pulmonary hypertension. And that can include patients who are pediatric patients all the way to adults, male or female, taking these medications, not just for recreational use, but to actually treat for pulmonary hypertension. Last but not least is our superstar, or the GOAT, aspirin. Aspirin's an antiplatelet. Now this seems to come out of the blue as the star player, but at the end of the day, aspirin helps to prevent platelet aggregation, which means it keeps the clot from getting bigger if there is one growing. This is often one of the first interventions you'll see, and some may argue even one of the most important. So just remember, MONA and FONA is a memory tool for treating our patients that come in with chest pain, or if we suspect them of having a heart attack. ABCs still come first, along with their 12-lead EKG to verify if they're having a STEMI. Hope you guys enjoyed. Thanks for watching. As always, hit the subscribe button at the bottom for more tips and tricks on nursing and NCLEX. And also, join the Breaking Down Nursing community on School and study along with other nursing students across the country. Get access to NCLEX-style practice questions, live study sessions, challenging case studies, and as always, take care. See you next time.